We are experiencing a really difficult year with cholera in several parts of Africa. National Red Cross and Red Crescent societies in Mali, in Chad, in Democratic Republic of Congo are already responding to cholera outbreaks in their countries with the support of international federation. And I'm especially concerned about the situation in Chad, where the epidemic started already late 2010, and until today we have not been able to bring the epidemic under control. Cholera is an intestinal infection. People in Chad call it the disease of dirty hands, and that's a very good description of cholera because it is the lack of sanitation, lack of safe water that fuels the cholera outbreaks. You get cholera by ingesting the vibrio that causes the infection, and it leads to bad diarrhea, sometimes within hours, which lead to dehydration and very fast death. There are several factors that can fuel a cholera outbreak. Changes in the weather patterns, floods, lots of rains that make latrines in communities to get flooded, and their water sources to get contaminated. People on the move, for instance, migrant populations are especially at risk for getting cholera. People living with HIV, they have special needs regarding hygiene and nutrition, and they are unproportionately hard hit in cholera outbreaks, and they do need our special attention when we are planning interventions regarding treatment and health promotion. It's important to provide good quality treatment to people who already are sick. It is important to ensure that people who have moderate symptoms of cholera can get oral rehydration in oral rehydration corners in their own community. And it's important to find the cases early enough so that you can refer them to treatment. The International Red Cross and Red Crescent movement has an exceptional capacity in providing fast and good quality response in outbreaks through the emergency response unit system. These are units that are ready-made with staff that are especially trained for this purpose. They can be deployed with very short notice, and they can support the National Red Cross, Red Crescent Society in their response to the cholera outbreak. There's a lot of fear connected to the word cholera. People are afraid of cholera epidemics because there are a lot of mental images and perceptions about how cholera kills. And yes, a cholera outbreak is a serious event, but the fear may not stop people from health-seeking behavior, and sometimes people start avoiding seeking treatment. And again, in this, the volunteer networks of the National Red Cross, Red Crescent Society are in a key position because they can act as a link between the formal healthcare sector and the community.